To consult with Colonel Brandon on the best means of effecting the latter was a thought which immediately followed the resolution of its performance, and as soon as she had rung up the maid to take her place by her sister, she hastened down to the drawing-room, where she knew he was generally to be found at a much later hour than the present. It was no time for hesitation. Her fears and her difficulties were immediately before him. Her fears he had no courage, no confidence to attempt the removal of. He listened to them in silent despondence, but her difficulties were instantly obviated, for with a readiness that seemed to speak the occasion, and the service prearranged in his mind, he offered himself as the messenger who should fetch Mrs. Dashwood. Eleanor made no resistance that was not easily overcome. She thanked him with brief though fervent gratitude, and while he went to hurry off his servant with a message to Mr. Harris, and an order for post-horses directly, she wrote a few lines to her mother. The comfort of such a friend at that moment as Colonel Brandon, or such a companion for her mother, how gratefully was it felt! A companion whose judgment would guide, whose attendance must relieve, and whose friendship might soothe her. As far as the shock of such a summons could be lessened to her, his presence, his manners, his assistance, would lessen it. He, meanwhile, whatever he might feel, acted with all the firmness of a collected mind, made every necessary arrangement with the utmost dispatch, and calculated with exactness the time in which she might look for his return. Not a moment was lost in delay of any kind. The horses arrived even before they were expected, and Colonel Brandon, only pressing her hand with a look of solemnity, and a few words spoken too low to reach her ear, hurried into the carriage. It was then about 12 o'clock, and she returned to her sister's apartment to wait for the arrival of the apothecary, and to watch by her the rest of the night. It was a night of almost equal suffering to both. Hour after hour passed away in sleepless pain and delirium on Marianne's side, and in the most cruel anxiety on Eleanor's, before Mr. Harris appeared. Her apprehensions once raised, paid by their excess for all her former security, and the servant who sat up with her, for she would not allow Mrs. Jennings to be called, only tortured her more by hints of what her mistress had always thought. Marianne's ideas were still, at intervals, fixed incoherently on her mother, and whenever she mentioned her name, it gave a pang to the heart of poor Eleanor, who, reproaching herself for having trifled with so many days of illness, and wretched for some immediate relief, fancied that all relief might soon be in vain, that everything had been delayed too long, and pictured to herself her suffering mother arriving too late to see this darling child, or to see her rational. She was on the point of sending again for Mr. Harris, or if he could not come, for some other advice, when the former, but not till after 5 o'clock, arrived. His opinion, however, made some little amends for his delay, for though acknowledging a very unexpected and unpleasant alteration in his patient, he would not allow the danger to be material, and talked of the relief which a fresh mode of treatment must procure, with a confidence which, in a lesser degree, was communicated to Eleanor. He promised to call again in the course of 3 or 4 hours, and left both the patient and her anxious attendant more composed than he had found them. With strong concern and many reproaches for not being called to their aid, did Mrs. Jennings hear in the morning of what had passed. Her former apprehensions, now with greater reason restored, left her no doubt of the event, and though trying to speak comfort to Eleanor, her conviction of her sister's danger would not allow her to offer the comfort of hope. Her heart was really grieved. The rapid decay, the early death of a girl so young, so lovely as Marianne, must have struck a less interested person with concern. On Mrs. Jennings's compassion she had other claims. She had been for 3 months her companion, was still under her care, and she was known to have been greatly injured and long unhappy. The distress of her sister, too, particularly a favourite, was before her. And as for their mother, when Mrs. Jennings considered that Marianne might probably be to her what Charlotte was to herself, her sympathy in her suffering was very sincere. Mr. Harris was punctual in his second visit, but he came to be disappointed in his hopes of what the last would produce. His medicines had failed. The fever was unabated, and Marianne, only more quiet, not more herself, remained in a heavy stupor. Eleanor, catching all, and more than all, his fears in a moment, proposed to call in further advice. But he judged it unnecessary. He had still something more to try, some more fresh application, of whose success he was as confident as the last, and his visit concluded with encouraging assurances which reached the ear, but could not enter the heart of Miss Dashwood. She was calm, except when she thought of her mother, but she was almost hopeless, and in this state she continued till noon, scarcely stirring from her sister's bed, her thoughts wandering from one image of grief, one suffering friend to another, and her spirits oppressed to the utmost by the conversation of Mrs. Jennings, who scrupled not to attribute the severity and danger of this attack to the many weeks of previous indisposition which Marianne's disappointment had brought on. Eleanor felt all the reasonableness of the idea, and it gave fresh misery to her reflections. About noon, however, she began, but with a caution, a dread of disappointment which for some time kept her silent, even to her friend, to fancy, to hope she could perceive a slight amendment in her sister's pulse. She waited, watched, and examined it again and again, and at last, with an agitation more difficult to bury under exterior calmness than all her foregoing distress, ventured to communicate her hopes. Mrs. Jennings, though forced on examination to acknowledge a temporary revival, tried to keep her young friend from indulging a thought of its continuance, and Eleanor, conning over every injunction of distrust, told herself likewise not to hope. But it was too late. Hope had already entered, and feeling all its anxious flutter, she bent over her sister to watch, she hardly knew for what. Half an hour passed away, and the favourable symptom yet blessed her. Others even arose to confirm it. Her breath, her skin, her lips, all flattered Eleanor with signs of amendment, and Marianne fixed her eyes on her with a rational, though languid, gaze. Anxiety and hope now oppressed her in equal degrees, and left her no moment of tranquillity till the arrival of Mr. Harris at 4 o'clock, when his assurances, his felicitations on a recovery in her sister even surpassing his expectation, gave her confidence, comfort, and tears of joy. Marianne was in every respect materially better, and he declared her entirely out of danger. Mrs. Jennings, perhaps satisfied with the partial justification of her forebodings which had been found in their late alarm, allowed herself to trust in his judgment, and admitted, with unfeigned joy, and soon with unequivocal cheerfulness, the probability of an entire recovery. Eleanor could not be cheerful. Her joy was of a different kind, and led to anything rather than to gaiety. Marianne restored to life, health, friends, and to her doting mother, was an idea to fill her heart with sensations of exquisite comfort, and expand it in fervent gratitude. But it led to no outward demonstrations of joy, no words, no smiles. All within Eleanor's breast was satisfaction, silent and strong. She continued by the side of her sister, with little intermission the whole afternoon, calming every fear, satisfying every inquiry of her enfeebled spirits, supplying every succour, and watching almost every look and every breath. The possibility of a relapse would, of course, in some moments, occur to remind her of what anxiety was, but when she saw, on her frequent and minute examination,